you're on the OR table. So, but we would move them on that stretcher from pre-op to the OR if they needed that special eye stretcher.
Okay, so I want to make sure I'm understanding. So you, at your facility, you're not doing the typical cataract type procedures. It's more eye trauma?
Correct, yeah. We will do cataracts on like people that are sick, more sick, you know, if they have to be done here from an anesthesia standpoint, but it's clear it's not, definitely not one of our top volumes. That's more at our ambulatory surgery facility is where they do all of, or majority of the eye cases, elective cataracts, things like that.
Okay, and so for the surgeries that you perform on the eye stretcher, that eye stretcher, are they put on that in pre-op or they're transferred to it in the OR?
Transferred in the OR.
Okay. And then
usually there's more than one patient. Oh, sorry. There's usually more than one patient because, you know, you're not just going to do one. They'll do 2 or 3 that day. And so we only have one of them. So if the patient came into pre-op, I mean, idealistically, yeah, they should be on it in pre-op. Then you don't have to move them. But but we just don't. We only have one because of our volume is so small. So.
Okay. And so when you were saying eye trauma, that seems more like emergent, like not outpatient, not a scheduled outpatient, but this seems to be this. Okay.
Yeah, they would be, you know, whether a trauma patient, you know, that in-house or an inpatient, yes.
Okay.
But the cataracts that maybe are just more sick are outpatient. Like they will come in same day and go home same day. They just have to be done at our facility just based on anesthesia standards and things like that.
Yes. Okay, I understand that. And then for other outpatient procedures in particular, does the patient flow, is it always that the patient's on a stretcher, move to the OR table and back to a stretcher, or could you describe that process for me?
Sure. So anybody that is coming in same day, whether they're going to stay overnight, so if they're going to come in today and go home today, they go from the stretcher to the OR table, back to the stretcher, and go to PACU recover, go back to phase 2, recover, and go home. If you are coming in today, but you're going to stay overnight, like you're having a total joint done, you come in, you go on a stretcher, then you go into the OR, you get moved on the OR table. Then from the OR table, you get moved onto the bed that you are going to, that's from the room that you're going to, or one that is like that. So you're moved to your post-op bed if you're staying overnight.
Okay. And the reason for doing it that way?
It's just so it decreases the number of moves they would have to make. So you're only moving from stretcher to OR table to final resting place versus stretcher, OR table, stretcher, final resting place. Okay. Just, and then for like I said, for the move.
Okay, but for the eyes that you're doing, is it because you don't have the volumes that you're not trying to?
Right.
Keep
I don't have more than I don't have more than one OR eye stretcher, quote unquote stretcher. So we always use the eye stretcher like the OR table at that point. That's what it is. You know what I mean?
Okay. Mhm. And then, so for your facility, what are the key focus areas that you guys are working on right
now? In relation to what?
Areas of improvement that you're working to.
Oh, sure. I mean, I think the standard things that most ORs look for are efficiency metrics. So, you know, how are we getting patients in, effectively utilizing the time that we have, making sure that patients are in on time, making sure that when we do, you know, turn over the rooms that it's in a timely fashion. Quality metrics are always something that we look at. That kind of goes without saying, you know, how to reduce surgical site infection, how to, you know, decrease catheter-associated urinary tract infections, falls, all of those things. And then I think you look at financial issues, like how to decrease costs but keep quality or increase quality. So, I mean, I think we look at